Hi, my name is Marty Smion. I'm co-CEO of Weave. First and foremost, we're grateful to be participating in this forum, and we're very thankful to the state of Utah for all they're doing to help Utah companies during this time of COVID. Thank you very much. We appreciate it. Let me introduce you to Weave. Weave is a customer engagement and communication platform for service-based businesses. And as everyone out there knows that provides a service, your business is based on the customers that you serve, and that's based on the communication that you have with them. Weave provides a complete platform from the phone call all the way to the final invoice that allows you to communicate effectively and personally with your patient, customer, or client. Weave's unique integration of hardware and software solutions helps streamline that communication, bringing it all together into one platform and into your office. We recently commissioned a survey, and that survey went out and interviewed hundreds of patients as well as medical professionals that provide service. We found this is very interesting. 93% of patients are delaying care until the COVID-19 pandemic eases. What does this mean? Things like dental cleaning, elective surgery, eye examinations, physicals, and many other routine medical procedures are being delayed because of concern over COVID. And what is this concern? Why are they concerned about it? Well, here's the problem. We have a healthcare group on one side that have gone through extraordinary lengths to make sure that their offices are clean, safe, and secure. They've done everything from replace ventilation systems, to put up glass partitions at the front desk, to sterilizing their chairs in between every single visit as well as every other instrument they use. Extraordinary lengths to make sure that you're safe and secure. However, 78% of healthcare clients are reluctant to go into healthcare practices. This is a problem because so much effort has gone in to making it safe, but yet the communication back to the patients to let them know exactly what's been going on within the office hasn't taken place. The patient isn't there when you're having your monthly and weekly and daily meetings to talk about things that you're doing within your office to make sure they're safe and secure. However, there are many ways to communicate that to the patient. But what's happened is there's been a gap created there, a communication gap. Several solutions to close this gap. Minimize human contact in non-traditional areas is one of them. Communicating with patients to ensure a sense of safety, and creating a safe environment end-to-end with contactless payments. These three actually are major concerns and issues with patients. So being able to communicate with them exactly what's going on in your office and how you're dealing with this gap between what physicians have done and what patients understand they've done is part of what I'm going to be discussing today. First, I'd like to address minimizing human contact. This time of COVID, all we worry about is human contact. Social distance economy, staying away from each other. Well, as a patient, there's worry about that. And as a provider, going through extraordinary means to accommodate the patient in a safe, secure way. So let's talk about a few of those ways that are being implemented in order to provide the minimizing of human contact. Well, on the Weave platform, we offer wellness forms. One of our practices that we have as a customer uses our wellness forms to send out a day in advance to patients in order to check their symptoms and to get an idea of whether or not they are an individual who might be suffering from COVID or an individual who can be brought into the office in a safe and secure fashion. Well, these are means that they're going through, and two, in order to ensure safety of other patients as well. Another thing that we're doing is providing curbside check-in. Think about it. When you go to your physician or your dentist and you walk into a waiting room and you're there with everybody else, that doesn't feel right now. Well, curbside check-in eliminates the need to do that. This is actually something that has been adopted very quickly within the medical community. You can wait in your car, you can wait until you receive a text, and then you have the ability to come up to the office and receive care when they're ready to receive you, so you don't have to wait in the office at all. These are details that quickly and easily show patients that you care about their safety, that you are concerned about them individually. It's a personal touch that allows patients to feel like they are being serviced, but yet they're also feeling like they're being communicated with, so they know exactly where they are, what they need to do, and so they're not in a waiting room with others, they're in a car, and as soon as they're texted, they're able to come up to receive their care. Another thing we're doing is providing mobile app. First couple of things I just talked about, really and truly more for the patient. With the mobile app, it's for the office. Individuals that work in the office can download the Weave mobile app. They have the ability to then be anywhere that they choose to be and act as though they're in the office. If a call comes in, they can take it. If they need to find records for patients, they can find them. And this is especially important when new patients are calling in, because they can take the call from anywhere as though it's at the office, and they can maneuver and navigate through the mobile app as though they're at the office. And again, this is just a way for the provider to be able to have a continual means of communication with those that they provide a service to. We also offer Team Chat. Team Chat is an interesting means of communication because it allows a very secure environment of communication to take place within an office. Whether I'm working at the front desk and I need to get confidential records from somebody in the back, I have the ability to message them and have a secure link to them, but do it in real time. This is something that has enabled offices to just have a much more significant communication link, as well as efficiency gains within the office. Next, I'd like to talk to you about creating a personal touch. At the end of the day, if you're a service provider and you provide a service to a customer, a client, or in the case of today when I'm talking mostly about patients, you want to be able to provide that personal touch, even if it's in a distancing fashion. Well, the Weave platform provides multiple tools to be able to do that. Patients in the survey commissioned that I mentioned a moment ago stated that they prefer texting, calling, and emailing for maintaining contact with healthcare practices during COVID-19. Well, the Weave platform provides for all of that. VoIP phones, text messaging, email marketing, and review requests are all elements necessary in a communication platform today that's needed in an office to effectively communicate in a way that your patient wants you to communicate with them. The first thing I want to talk about is VoIP platform. When we go into a new customer, we replace their VoIP platform system. That VoIP system digitalizes or begins the process of digitalizing their entire office. The VoIP system is connected to the software stack, which then enables a complete communication platform to be enabled across your entire office. Phone capabilities, accessibility from hardware and desktop and mobile app, all available once you get the VoIP platform in. This is critical to an office that uses desk phones because it digitalizes it so you can capture all the data that comes into the phone call, and you can capture data that flows through your entire communication stack and through your communication network. One customer of ours said, your younger patients are eager to text. Once you have a VoIP phone system set up in your office, texting can be linked with it to open up new opportunities for maintaining effective communication with clients. And again, when you digitalize the entire experience, you can utilize it across the entire platform. So however your patient wants to be communicated with, you're able to do that, and VoIP is a part of that. Next, in an effort to have that personal touch, even though we're in the distance community, well, messaging. We all message each other, whether it's a text, a direct message. Messaging is the way that most people contact each other nowadays. Well, patients are the same way. And just to reiterate, you want to contact your patients and communicate with your patients in the way that they want to be communicated with. Well, messaging in a practice is a vital part of that, especially to maintain that personal touch. Messaging is more than just texting a patient when they need to come up for their appointment, or texting them to confirm an appointment. Also, you can use texting or messaging with missed call SMS, which is part of the Weave platform. If your phone rings, you don't answer, well, if I'm a patient and I'm looking for a new provider, I'm just going down a list and I'm going from review to review and I go to the next one. Well, with missed call SMS, what happens is the phone rings and a message is sent back to the patient saying, sorry, we can't come to the phone right now, or we can't get to the phone. We'll call you right back. Well, what happens is they stop going down the list and they wait for a call back. And if it's an existing patient, it's a great personal touch just to say, hey, sorry we missed your call, we'll call you right back. Well, this enables an office to have that personal touch in such a way that you're able to maintain a relationship or build a relationship, not just have communication flow, but actually have that relationship developed for you. Email marketing is another element of personal touch. Whether you're doing an email marketing campaign in mass or you need to target specific elements of your patient base. Weave's platform allows for email marketing to be customized as you need to use it. One of our customers has 25 offices, and they needed to send a mass email to all of the patients, letting them know that certain of their offices would be closed. They provided a number in case this is an emergency, so that if there is a patient who needs care, they know how to get it, but more importantly, they're communicated with and they know exactly what's going on with the practice. Well, that seems like common courtesy, but to the patient, it's very personal. Because if they need care, they need to know how to get a hold of you. And email marketing is a way to keep that constant means of communication to your patients. In addition, you can highly target segments of your patients that you want to reach out to. For example, one of our customers used email marketing to reach out to all of their patients, this is an optometrist, to communicate with them, to let them know that if they have a supply of contact lenses that are less than 90 days, that they should reorder their contact lenses just in case there is a disruption in supply chain during COVID. Again, just having that personal level of care and personal level of touch with the patient, showing that you care about them, is critical to them. Yes, it resulted in additional revenue for the practice, but more importantly, it made sure that patients had their needs met, regardless of what was going to happen in the future. Next is reviews. I think we all are sold on reviews. Everybody uses reviews. One of our customers moved to reviews and they increased their customer acquisition or their patient acquisition by 324%. I mean, that's huge. 17 new patients a month, 10 online reviews 1 month. They start using reviews, and the next month they're achieving 76 new patients a month and 200 online reviews. The reviews are great and wonderful, but reviews are also ways that patients can communicate with patients to let them know about the safety and security of your office, to let them know what precautions you're taking in order to make sure they're safe during this time of COVID. And it's turning out to be a very effective way of not only to rate the practice, rate the physician, but also to let others know about the practice and all of the efforts being made to close this gap between what physicians and practitioners are doing within their office to ensure safety and security and what patients understand. Because again, when you have 78% foregoing care, which is just routine, that's a problem. They need to understand that it's safe and secure to go back into an office. Protecting customers and staff with contactless payments. This seems like a very simple thing, an easy thing, but during COVID, it's become a very important way for customers to feel safe, for patients to feel safe when going into an office, when rendering payment. Well, text-to-pay is a very convenient way for a provider to provide a means by which a patient can pay a bill, but it's also a way for the patient to feel very safe in the environment in which they're rendering payment. Think about it. You walk into a store, you pull out your debit card and you put it into a machine. The first thing you do is you think about, wow, I don't want to touch that. I'm thinking COVID. And that is the way we have all started thinking. Well, contactless payments through text-to-pay is a way to offer a very safe, secure way to render payment. 64% of clients feel safer at a healthcare facility that offers contactless payments. However, only 19% of healthcare facilities actually offer this as a service. One of our customers collected over $10,000 in payments over the last 12 months just using text-to-pay. This is a means by which, yes, if service is rendered, you can ask for payment for the service that was just rendered. However, it's also a means by which if you are having someone come in for an appointment and they have a $50 balance, you can send out a appointment reminder, and in the appointment reminder itself, just add on, hey, you have a $50 balance, click here to pay. It's very convenient, and it's also a very convenient way to collect on past accounts receivable. 30 plus hours are saved on a monthly basis just through invoicing using contactless payments or text to pay. 250 plus in monthly printed invoices are replaced. Over $200 in average monthly savings from eliminating all the invoices, envelopes, and stamps. And most of all, just the sheer convenience of it for the practice as well as for the patient. So again, the problem. Healthcare practices are nearly 7 times more likely to say that during this time of COVID, they have massively increased the cleanliness, the effort and facility within their offices to accommodate patients from the time you walk in until the time you leave, making you feel safe and secure about your visit and about the treatment you received. However, there's 78% of healthcare clients that are reluctant to go into a practice. That's the problem. So once again, solutions to close the gap: minimize human contact, communicate with your patients, and create a safe environment by which patients can pay for services rendered. These 3 things will help close the gap considerably, and make sure that you communicate everything that you're doing within your office to make it safe and secure with your patients. And lastly, keep it safe, make it convenient, and communicate your safety and convenience in such a way that they understand, that your patients understand all that you're doing to ensure that not just that you're keeping them safe, but that you care about them. Thank you.